Hey guys, welcome back to the channel Side Dental Blogs. It's 1:30 p.m. and today I want to thank you all on this occasion of Rath Yatra. So today is Rath Yatra in Odisha. Lord Jagannath will go from his home to his Mausi's home, and this is a very big festival of Odisha. And to all my dear friends, a very good morning. So today I am thankful to everyone who is watching my videos, who are my subscribers, for making it 10,000 subscribers. Today on this auspicious day only in the morning I came to know that I have reached 10,000 subscribers. And if you are watching this video for the first time, I am Dr. Abhishek and I make dental related videos. So I am working as a reader in Department of Oral Medicine and Radiology in Institute of Dental Sciences, Bhubaneswar. Right. So today I won't be taking any kind of topic, but today I would like to give you a demo of a root canal treatment. So I will just, this is not actually demo basically, this just a push to you people so that you can start with the root canal treatment. Those who have not started, those who are interns, third years, final years, whoever are doing the root canal treatment, so they will have a brief idea of how to start the root canal treatment, what is the basic armamentarium I have already told in my other videos. So today I will be starting a root canal on an anterior tooth. I will give you the demo of the access opening, how it's all about, what is the feel, and how do you have to use the file. That's these things I'm going to tell you, right? So first of all, we have this dental clinic. I have all this set up, you know. So abhi ye daant hai, and you see I have done a marking on the palatal surface of the tooth. So this is actually the point where you are going to do the access opening with the round burr number 2. Right, so I have put my round burr in autoclave. Everything, all the burrs, only one burr was outside, so I am using with the straight fissure burr. But you don't try it with the straight fissure burr in the very beginning. What will happen if you do it with the straight fissure burr? It may get perforated from the facial surface. So take a small round burr and do the access opening. So I am going to show you how to do the access opening. So I will wear my gloves, and the files with which you are practicing on the tooth, you should make it separate file. You should not use it on any other patient. This is very important. First, and you have to mount the tooth in some plaster. Like you take a small cup and you mix plaster in there, and then you can put the tooth inside and you can start with the access opening of the tooth which you want to learn. Before learning the access opening, you have to read Cohen Pathways of the Pulp. There is a chapter in the book Cohen which is easily available in all the dental libraries. You go there and you read that chapter and you will know the canal anatomy, the working length, regarding how to take the radiograph. Everything is there in that book. Or you can, if you don't have that book, you can buy, you can check Grossman also. That is there in all the libraries, Grossman. Okay, so we'll start with this. So first of all, you need to have this basic aerator and all. So this is my aerator. Oops, water. So I am making a small ditch hole, if you can see, in this point which I have made. Okay, so I'll just do the access opening is only this much, and you have to do on the patient, right? So just I am holding it and I am using the burr. Bus. So when you do this, when you are working on the tooth, you will get a small release of pressure. Means when you are making the hole, you are giving some force, and at a particular point you will suddenly your hand will move. Means you will feel like there is no tooth at all. So that is the canal or the pulp chamber you have entered. So as soon as you enter, you make a ditch hole. You have to take a number 8 file. I have kept here many files for giving demos and all. Many students are also coming and they are learning. So this is a normal number 8 file, so which is grey in color. So you have to insert that file in a watch winding motion. Watch winding motion like this. You have to hold the file and do like this. You should not rotate it all the way. You should do it in a watch winding motion, and you have to just insert it. See, ये canal के अंदर चला गया ये पूरा, right? If I do it in a watch. So now you see the angulation So this will be in the same in the patient, right? This should not be the angle with which you are putting the file inside the tooth. This should not be the angle. The angle should be straight. Your file should be straight. So how to make it straight? You have to remove the extra dentine which is present above the ditch hole you have made. So I will remove the extra dentine above the ditch hole. So I don't know whether I am just doing justice to the camera or not, but this is the way it is. So I'll make a ditch hole. I will extend the ditch hole which I have already made. So as you have seen already that I have made the access opening. Now you can see here I am again putting the file inside in a watch winding motion, and it's going very easily now. Now you see the angulation has changed a little bit. Earlier it was like this, but now it has become like this. So it should be almost straight. The access opening should be in a straight line access, right? So what I have to do now, and one very important instrument you should have in your clinic, that is the apex locator and the radiograph, whatever you want to have. So this apex location, if you in your initial practice, even if you don't have an apex locator, you can skip it for a few days, like 6-7 months. After you get some money, then you can buy the apex locator. It will be very easy for you. You don't have to take the walking length x-ray, and you all know there is a principle of taking x-rays which is known as ALARA, as low as reasonably achievable. So जितना कम एक्सरे लोगे पेशेंट का उतना अच्छा है. तो एक्सेस अगर आप ले लेते हैं एपेक्स लोकेटर, तो यू need to take the x-ray of this. So once you take the x-ray, so the tooth is blind, it is inside the bone, right? So you cannot see anything. So once you put it inside, you need to take the x-ray to measure the working length. So with what we will measure the working length, I have already shown. You have to take this endo block, which is of Dentsply. The company name is Dentsply. So what does it do? It takes, there are measurements written on this and also on the sides, right? So you can make the measurement like this. Whatever is the length of this tooth, you can measure it, and then you can proceed with the next file after doing some filing. So how will you do the filing? You have to just rotate the file a little bit, and then you have to do to and fro motion. So while doing the to and fro motion, you have to make sure you have to do a circumferential filing. Means you should file it all the directions. Filing means ghisna basically. So you push the file towards the buccal side of the tooth and do 7 to 8 times. You have to do the filing to and fro. Then again on the mesial side, lingual side, and also on the medial side. So this way, after this you have to do the irrigation. Irrigation means you have to take the syringe. A syringe is required for this. So after taking the syringe, you have to put inside this access opening, you have to irrigate it with lot of saline and lot of hypo, sodium hypochlorite 3%, right? So once all the debris comes out, you have to proceed with the next file. So which is the number 10 file. So this is again the 10 file. So after proceeding with the number 8 file, again you have to do it with the 10 file. Before that you have to do irrigation, which is very much required. So again इसको फिर मैंने irrigate, इसको मैंने filing किया number 8. So you see the canal is getting larger every time, right? So you have to prepare this K file to, this all K files are coming from Dentsply company money. So this is all 2%. 2% means the thickness is very less, it's very thin, right? So you can even do it with a pro taper after filing with number 20 file. So once the straight line access is achieved, see the access has, I have got the access, a straight line access which is almost parallel to the tooth. It should not be like this, or should not be like any other direction. It should be totally straight line access. Okay, so I am holding the tooth like this. So this is the way the access opening of an anterior tooth is done. So in my other videos I will show other tooth also. So I am not showing the entire process of filing and BMP because the video will become too long and I don't want to make such a long video. And first of all I will only show you the access opening of various teeth. Then we'll go to the next step of BMP, then to the next step of obturation. So by this you can learn very easily and you can have at least an idea like why I am giving the idea. So when you are reading from the book you will get an idea, okay, this is the way it is done, okay, this was the way it is done. So you can try it in your clinic or you can try it in your hospital or college or in your hostels also. Only you need a air rotor connection with the burr. So today I will end the video here. Next time I will show you the access opening of canine and premolar tooth. And I hope this video was a little bit useful for you. Not that much I know, but still today I wanted to make some separate demonstration video, so I don't know how it will go about. And if you have not followed me on Instagram, please do follow me on Instagram in Sai Dental Vlogs. I'll be very happy to give answers to your DMs. Till then, take care, goodbye, have a good day.